Hi, this is my head to toe assessment for 607. Here's the room tour along with my patient. Okay. Alright. So I'm going to start off with some hand washing. Hi John, my name is Monica Dobek. I am a nurse practitioner student, and I'm going to be performing your head to toe assessment today. Alright, if you have any questions along the way, just feel free to ask. Can we just start off with your name and date of birth, please?
Tom Torres, 7797.
Alright, so just looking at this patient's general appearance, patient appears well kept, no apparent distress, dressed appropriately for the occasion. He's making good eye contact with me, pleasant. So just moving on, we're gonna assess his skin that is visualized. So if you could just looking at his skin here, no moles, no rashes, no lacerations, sores, any wounds that are apparent. Skin is warm and dry, color is appropriate for ethnicity. I am going to check your capillary refill. Good. Good, less than 3 seconds. And we'll check it down here as well. Good, less than 3 seconds. While I'm down here, I'm just gonna assess for any edema. Good. And no apparent edema is noted. So I'm gonna have you also put your hands together like this. All right, no clubbing is noted. All right, nails appear nice, clean, dry, and intact. I'm going to just move on to your skin or hair now. So full head of hair, black hair, no obvious signs of balding, well distributed. Let's see, it's like a fine texture, no dandruff, no nits, no masses. Any tenderness to this, Tom?
No.
Okay, excellent. Looking at his head here, head appears normal cephalic. It is symmetrical. Patient making good eye contact. No nystagmus, no ptosis noted. Eyebrows appear symmetrical. Eyelashes are curled upward. We're going to check your cranial nerves now here, Tom. I would like you to smile for me. All right, relax from. All right, I want you to open your eyes wide. Close your eyes tight. Good. Now I would like you to puff out your cheeks. Good. Relax. Open your mouth and say ah. All right. Move your tongue side to side. All right. Cranial nerves appear to be intact. I want you to bite down. Smile. Bite down for me. Masseter muscle contracts bilaterally. Excellent. What I'm going to do next is I'm going to feel for your temporal arteries. Alright, temporal arteries appear to be +2. Excellent. We're going to feel for your TMJ. So I'm just going to place my hands here. And open and close your mouth. Okay, move your jaw side to side. Any pain with that?
No.
Non-tender, no clicking, no crepitus noted to that area. I'm going to feel for your sinuses here. Alright, good. Any tenderness?
No.
Alright, no tenderness noted to the frontal and maxillary sinuses. Open your mouth for me once more. Say ah. Great. Uvula rises upon inspection. I would like you to, as we're sitting up, I would like to test your range of motion of your neck. Neck does appear when he's sitting nice and symmetrical, midline. I would like you to move your head side to side, front, back. Excellent. Rotate it in a circle. All right. I am going to have you push against my cheek and push against this cheek. All right. Sternocleidomastoid, full resistance to sternocleidomastoid, and I would like you to shrug against my hands here. All right. Trapezius muscles contract bilaterally. All right, Tom. now that I have you here, what we're going to do next is we're going to do your eye exam. So just doing an overall inspection of your eyes here, Tom. Eyes do appear, pupils appear equal, round, intact. They're about 3 millimeters bilaterally. Let's see, brown eyes, sclera is white. Just look straight. Conjunctiva is pink and moist. Cornea is clear. Have you had any vision problems lately?
No.
Alright, excellent. So we're just going to do the Snellen test. I'm going to have you hold this out about 14 inches. Okay? And cover one of your eyes for me. And if you could read the lowest line.
The last line is 426739. E normal, E facing up, and then E facing down.
Okay, now switch eyes for me. A little bit further out. Okay.
The numbers are still the same, 426739. E is still the same way. Normal, then facing, laying on its back, and then facing down.
Okay, and now I'll take this away if you could just read them both.
It's, again, 426739. E facing that way, E facing up, E facing down.
Alright, great. Patient appears to have 20/20 vision. No apparent problems there. So what we're going to do next, Tom, is I would love for you to, we're going to do the direct and indirect test. So what I'm going to do is just shine a light into your eye. Alright, pupil constricts. And now I'm going to do this on the other eye. Alright, pupils constrict bilaterally. And now the indirect test, I'm going to shine this. And then opposite eye constricts with the light. And I would perform this on the other side as well. So I'm going to have you look at my pen here. And then look at the wall. And then look at the pen again. Alright, so pupils are constricting as he's looking at the pen versus at the wall. Now I'm going to have you look at my pen light here. And follow it. This is testing for convergence. Bilateral eyes are converging and it appears intact. What we're going to do now is we're going to test your peripheral fields. Just let me know when you see my hand.
No. 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 No.
Alright, peripheral fields are intact. Doing your extraocular eye movements, just testing them. We're going to do those 6 cardinal gazes, so I want you to look at my finger and just follow it with your eyes. Excellent. Very well. Next, Thomas, we are going to take a little bit of a closer look into your eyes using the ophthalmoscope. So I'm just going to be getting a little close to your eye. What we're going to be doing here is just checking for your red light reflex, okay? Just look straight ahead, and then in practice I would dim the lights. Alright, red light reflex is visualized. Just going to get a little bit closer. Alright, optic disc is yellow. Retina is intact. I do see retina vessels. No hemorrhaging, no nicking. Excellent. What else? And I would repeat this process in practice as well. Good. Now, something that I wanted to go back, as you're sitting, just looking at your neck, Tom, I can see that your trachea is midline. Excellent. And what I'm going to do is I'm going to assess for your thyroid gland, okay? So I'm going to push against your thyroid gland, I'm going to come around back, and then when I tell you to, if you could just swallow for me. Alright, swallow. Alright, and we're going to breathe on the other side, turn this way. Alright, and swallow. Excellent. So thyroid appears that there's no nodules, no masses, no goiters noted, and thyroid moves freely with movement. Excellent, Tom. So now we're gonna assess your ears. So ears appear symmetrical to the face, to the outer canvas. No erythema noted to the outer ear. Any pain or tenderness here?
No tenderness.
Okay, excellent. Auricle and mastoid are bilaterally non-tender. I'm gonna use my otoscope now, Tom, and I'm just gonna have you. I would in practice get a clean one. Look straight ahead, and I'm just gonna take a look at your inner canal. All right. Let's see. No debris noted. Minimal. Let's see. Earwax, but tympanic membranes are visualized pearly gray. No bulging. Alright. No erythema noted. No foreign bodies. And I would repeat that in practice on the other side as well. Dun, dun. So Tom, we're gonna just test your hearing. Any problems with your hearing lately?
No.
Okay, so I'm gonna have you cover your right ear. Okay, and I'm gonna stand about 2 feet apart, and I want you to tell me what you hear.
Purple disco.
Yes. Now cover the other ear.
Soccer ball.
And in practice, I would be a little bit more further back. All right, so now we're gonna do the Weber test. This is just testing whether you have any conductive hearing loss, okay? So what I'm gonna do is I'm gonna place this tuning fork on the middle of your head, and I want you to tell me if you hear it equal on both sides of your head, okay?
You got it. I hear it.
And is it equal on both parts, or you hear it more so on one side?
No, it's equal.
Okay,
It's in the middle.
Weber test is intact. Now we're gonna do the Ryan test. Same thing, I just want you to tell me when you can no longer hear it, okay?
Now. Now.
Good. Now we repeat that in practice on both sides. It appears that ear to bone conduction is 2 to 1, so no conductive hearing loss is noted. Hearing appears to be intact. All right, Tom. So now I'm gonna assess your nose. So nose appears to be intact. No erythema. No drainage noted. I'm gonna test your nasal patency. So I want you to breathe in. Okay. Other side. All right. Nasal patency appears to be intact. I'm gonna use this otoscope and just assess. So just look up a little bit for me. Alright, nasal mucosa appears pink and moist. No debris, no foreign body noted. Turbinates appear to be deep pink. Septum appears to be midline. Alright. Good, Tom, and I would do that on the other side as well. Excellent. So moving on, I'm gonna do no problems with your smell, correct?
No.
All right, we're gonna assess your mouth. Lips appear nice and full, pink and moist. No cracking, no like lacerations to the lips. I'm gonna have you open up your mouth for me. Just gonna do an overall inspection. Good. Pharynx appears nice and pink. Soft. Say ah.
Ah.
Uvula rises, soft palate rises upon inspection. Looks like the patient has like around 30 teeth, no dental cavities, no missing teeth noted. I'm gonna have you stick out your tongue.
Ah. Ah.
Alright, tonsils appear like +2, no exudate, no erythema noted. Okay, good. We're gonna assess your lymph nodes now.
Okay.
Just let me know if you feel any pain or tenderness. Occipital, post-auricle, preauricle, parotid, submandibular, submental, posterior cervical, inferior cervical, supraclavicular, and then infraclavicular. Okay, and then we'll assess your femoral lymph nodes a little bit later on. Okay, moving on, Tom, we're gonna just do the chest now. So overall appearance, patient appears to be in no distress. Rib cage appears to be appropriate to the patient. No signs of like loud breathing or anything. So no masses, no hernia, or no masses noted. So I'm just going to have you take a deep breath, Tom. I'm gonna do some thoracic expansion. You know, if you could turn to the side for me. All right. Take a deep breath in. All right, thoracic expansion seems to be about 5 centimeters with expansion. I'm gonna do some tactile femur-tests. If you could just say 99.
99. 99. 99. 99.
Okay, tactile femur-tests is intact. It is not abnormal. I am going to now, Tom. I'm gonna percuss your back. Okay. Alright, resonance noted in all lung fields. I am going to take a listen to your posterior lung sounds now. Take a deep breath. Just continue taking deep breaths. Excellent. No adventitious lung sounds, no no crackles, no rhonchi, no wheezing noted. So I'm gonna have you do the same thing, Tom. I'm gonna check for egophony. I want you to just say 99.
99. 99. 99. 99. 99. 99.
All right, and then say E.
E. E. E. E. E. E.
All right, excellent, Tom. Egophony is intact. I would then, in practice, listen to his anterior and then lateral lung sounds as well. Just trying to think if we're missing anything here. All right, Tom, if you want to just swing your feet over to this way. All right, Tom, I'm just gonna take a look at your chest. Your chest appears to be intact, no abnormal issues there. I am going to start off by, I'm gonna auscultate. Actually, I'm gonna feel for your carotid actually. +2 bilaterally, let me take a listen. All right, no bruise noted. I'm gonna check your radial pulses. +2, excellent. Your pedal pulses, +2, and then your dorsalis tibial. Excellent, +2, and just gonna feel for your femoral pulses as well. +2 as well. All right, I'm gonna take a listen to your anterior lung sounds using the diaphragm of my stethoscope. Aortic, pulmonic, tricuspid, and then mitral. And then I'm gonna use my bell and then listen as well. Aortic, pulmonic, tricuspid, and mitral. Alright, no murmurs, no clicking. S1, S2 noted upon auscultation. I am going to have you lie down for me, Tom, if you don't mind. Alright, I'm gonna lift up your shirt here. Alright, so the pericardium appears to be intact, no trauma to the pericardium, no heaving noted. I'm gonna assess your PMI here, so it's mid-clavicular, fifth intercostal space. +2 noted at the PMI. Excellent. Okay. Next, Tom, what I'm going to do is I'm just gonna inspect your abdomen. So no peristalsis, no masses, no hernias noted upon inspection. I'm just gonna check, so like I said, I'm gonna check for your femoral lymph nodes. And I would love to check for your inguinal hernia. So if you could just kind of sit up for me a little bit, move your head up and then cough. All right. And then cough once more. All right. No hernias noted upon inspection. I'm gonna just listen to your bowel sounds. All right, bowel sounds are active in all 4 quadrants. I'm using my bell. I'm gonna assess for any bruits. Checking the renal, the aortic, and then the iliac. All right, no bruits noted. I am going to just percuss your abdomen here. Any pain? Okay. No pain noted upon percussion. Patient does have tympanic bowel sounds with percussion, dull whenever we do go over the organs. I'm going to just do some light palpation. Let me know if you feel any pain.
No
Any
pain.
pain?
No.
I'm going to go a little bit medium. All right, and then deep. Any pain, Tom?
No.
All right, no pain. We're gonna assess for your liver here, and then your Murphy's sign. So take a deep breath in. Liver does not appear to be palpable, and then Murphy's sign is negative. Any pain or tenderness?
No.
Okay. That's for your spleen here. Alright. Any pain or tenderness?
No.
Spleen does not appear palpable. No splenomegaly noted upon. You can sit up for me, Tom.
Oh yeah.
Inspection. Alright, I'm gonna check for some CVA tenderness. This would indicate any type of pyelonephrosis. Any pain?
No pain.
Alright, excellent. Okay, Tom, what we're going to do next is we're just going to test some range of motion skills. Alright, so what I'm going to have you do is we're going to have you lift this leg up. Excellent. Now lift that leg up. Alright. Hips up here. Again, hips at full strength, 5 out of 5 against resistance. I'm going to have you push against my hands here. Okay, push back. Alright, good. Now, I would like you to whip your ankles, push down, push up. Now move them side to side, out and then inward. Okay, excellent. Now against my hands, resist, push back, excellent. Push back. Okay, excellent. So 5 out of 5 strength in those extremities. Now I also would like to do your upper extremities as well, Tom. So what I would like you to do is your arms go up and down, flexion and extension, flex, resist, resist, excellent. I would like you to put your hand up, down, out, in. Alright, no clicking, no crepitus noted, any pain?
No.
Alright, and then no erythema noted to any of the upper or lower extremities. I am going to do the NURS and Hawkins test, so what I would like you to do is take your hand and rotate it, and now lift, raise it up. Any pain?
No.
This is assessing for rotator cuff. Alright, excellent. And now your other one, what I'm going to have you do is put my hand here, and any pain or tenderness?
No.
Alright, NURS and Hawkins tests are negative. And I'll repeat that on the other side in practice as well. Put your hands out, down, up, fan them out, put them back in, good, resist, push down, excellent. Grab my hands, alright, good. 5 out of 5 strength in the hands and the wrists and fingers. Excellent, Tom. I'm going to have you stand up. We're going to test your gait. I would like you to walk across the room. Excellent. Gait up here steady. Now walking back, I'd like to do heel to toe. Yep. Okay. Excellent. Stand there. Face this way. We're going to do the Romberg test and the pronator drift. Close your eyes for me. Gait up here steady. And I'd like you to lift out your hands and then rotate them upside down. Rotate them out. Yep. Perfect. Gait up here steady. You can open your eyes. And I'm going to see your spine. If you could bend down. Assessing for scoliosis. No curvature to the spine. Spine appears intact. You can stand up. I'm going to have you lean forward, lean back, flexion, extension, and then side to side for me. All right, take a seat for me. I'm going to test your rapid hand movements. So you could do that for me. All right, excellent, Tom. We're going to do a quick deep tendon reflex. We're going to start off with, we're going to do the plantar reflex. All right, good. We're going to do the Achilles, okay? So just relax. Good. And we're going to do the patellar. All right, excellent. Now I would like to do your brachial. Just relax for me. Excellent. And we're going to do your trapezius. Relax. Excellent. And repeat it on the other side in practice as well. And we're just going to do your sensation test really quickly as well, Tom. Alright, I got a paper clip and a cotton ball. This is sharp, this is go. Sharp. You let me know which one you're feeling and on which side you feel it. Okay? Close your eyes for me.
Sharp cheek. Dull left cheek.
Okay.
Dull thigh left. Sharp right upper arm. Sharp left upper arm. Dull to the left quadricep.
Okay.
And that's sharp to the right lower extremity. Dull left lower extremity.
Alright, last one.
That's sharp to my right foot. Dull to my left foot.
Great job, Tom. And we're just gonna test the vibration in your feet and then your Achilles or ankles, okay? Let me know if you feel the vibration.
Yep.
Alright.
Yep, still feel it. Yeah, I still feel it.
Okay. Good. Now, we're almost done. Let me just think if I missed anything. Just gonna check my timer. And my timer's on. Alright, I would like you to touch my finger and then touch your nose. Good. Alright, that concludes my head to toe assessment. Thank you.
Thank you.